I asked a question on my Instagram stories whether you guys would take a panoramic radiograph, also known as an OPG, on that perfect patient. There is no tartar, there's no plaque, there is no complaints, the teeth are beautiful. Would you take the panoramic x-ray for that patient? And most of you, 75% or more, said that you wouldn't. And that is unfortunately a disappointing answer. Remember, there are a lot of information that you can get out of a panoramic radiograph, such as the presence of pathology. This is the biggest thing. Like, you may have cysts, you may have tumors, which you're missing because when you do an intraoral examination, you're only seeing about 30% of the tooth. You're not even seeing whether the patient has any kind of periodontal disease, or you don't know exactly where the bone levels are unless you start probing every tooth, which many of you may not be doing. It'll also help you assess the TMJ. It'll help you assess overall the maxilla and the mandible. It'll tell you whether there are any sort of subclinical fractures which haven't fully gone through and through, so the patient is not complaining yet. And of course, it'll help you evaluate periapical pathology, which again, the patient is not complaining about yet. Do not think that taking a panoramic radiograph is some kind of over-treatment or exposing the patient to unnecessary radiation. With digital panoramic radiographs, the amount of radiation is so small that it's not even worth considering this to be a risk anymore to our patients. So just remember, there's a lot of information you need to get from your patient before you formulate a treatment plan, and one of the biggest sources of information is that panoramic radiograph. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.